Wounds. One of the most amazing things about our bodies is its capacity to heal. While a character like Wolverine does some amazing healing, us normal humans can do some pretty cool stuff too. This video will look at healing from the perspective of a cut or wound of the skin. This is not only a common injury in the world of combat sports, but it is also something that us surgeons are inflicting on people every day, but in a controlled fashion. In this video, I will talk about the body's initial response to a cut and all of the steps up through a scar. I will also talk about the proper steps to take if you have a cut, as well as to prevent poor healing and scar issues later on. These steps could be the difference to prevent horrible complications or long-term issues that keep you from being your best. These include infections, tightness of joints, or our vision being obscured. Let's first talk about our skin and how important it is. It prevents water loss, helps regulate our body temperature, has nerves that give information to the brain, and act as an initial barrier, keeping the bad stuff out of our bodies. It should be clear that getting our skin healed as quickly as possible is important. Let's get into cuts. Bleeding, or controlling that bleeding, which we call hemostasis. This initial step is the one we all see. The cut and the bleeding. The veins and or arteries that carry our blood have been opened up and blood pours out. The more blood vessels cut, the deeper the cut goes, the more blood you'll see. Certain parts of our body, like our scalps, have a lot of blood vessels right under the skin. Immediately, our bodies go to work on controlling the bleeding. This is done in many cool ways. First, we will call it damage signals. They're sent out by injured cells. Proteins and other contents of those cells trigger a series of events that cause the blood vessels to contract or narrow down to stem the flow of blood and start the coagulation cascade. This is a series of steps that result in a mesh of fibrin that contributes to the blood clot. The platelets, or clotting cells, are activated and begin to stick to each other in the injured vessel wall. Platelets, along with the fibrin, form the blood clot, which hopefully blocks off any further blood loss and helps prevent bad things from getting in. The blood clot also contains many other proteins and growth factors that contribute to the next steps of the healing process. This clot also acts as a scaffold or ladder that other cells of the inflammatory and healing response can grab and begin to do their work. If you or someone else has a cut, if possible, apply direct pressure to the wound to help stop the bleeding. Direct pressure can be as good as a tourniquet in many situations and can be used when tourniquets are not an option, like on the head. Side note, people with certain diseases like hemophilia or von Willebrand's disease have issues with their coagulation cascade. This can be a big issue as it can be very difficult to stop their bleeding. Even a small wound can result in massive blood loss. Next step, step 2, the inflammation phase. This starts immediately and goes on for about 5 days after the injury. I also talked about inflammation in a whole separate video, you can see that. But as mentioned in step 1, the body's immune system is triggered and recruited to the area by the injured tissues and the forming blood clot to do some damage control, including cleaning up injured or dead cells and to start fighting off any invaders. Macrophages are an important example of these immune system cells. The cells of the immune system also release their own proteins and growth factors that further recruit other cells. Extra blood flow is recruited to the area to bring more cells and nutrition. We will notice the redness, swelling, and heat of the inflammation. There is some debate about whether anti-inflammatory medications or using ice disrupts these steps at this time. If used in moderation, I do not think that popping a few Motrin or icing a little bit causes any harm. The next phase, proliferation phase, starts a few days in and goes on for 3+ weeks. The tissues are now being rebuilt. New blood vessels start coming in. Cells called fibroblasts make their way into the wound. These cells start depositing collagen, which is a complex protein that is the beginning of scar. Soon, we have tissue that is called granulation tissue, which is a reddish pink tissue that sometimes you see little dots that are blood vessels. The skin cells at the margins of the wound then start to migrate across the granulation tissue until they meet in the middle. If it is a part of the body with hair, the hair follicles actually contain stem cells that can speed this process along. When the skin cells do meet in the middle, they stop duplicating, but the tissues deep to that area begin to fill in from the bottom up. Until the skin is healed, there's a potential entry point for bacteria or other bad things to get into your body. This is why it is a bad idea to grapple or do similar activities with open wounds. It is a potential point of entry that can lead to devastating infections. The last phase, maturation or remodeling phase. The collagen that was being laid down that starts around 1 week into this process, that goes on for about 1 month. Then a remodeling process to that collagen goes on that can take up to a full year. This phase is all about the scar. The initial collagen that gets laid down by fibroblasts is not very organized. In time, there's a remodeling process where the fibers of the collagen do become organized and the scar gets stronger. Wounds that can be closed by sutures or staples or glue, this is called primary closure, are going to heal faster as the skin cells do not have to migrate as far and the scar tissue and other things will be smaller. If you have a choice, this is the way to go for most cases. If you have a bad cut, see a doctor quickly. The final strength of a wound will vary by its location and its size, but in general, at 1 week, it's only 3% strength. At 3 weeks, it is 20% strength. At 3 months, it's 80% strength. At that point, it will sort of level off. The scar never gets back to 100% strength. You will notice that scars are stiffer and do not move like normal skin, which can have ramifications if they are in areas that move. Another type of healing, called secondary intent, is when a wound is left open and must heal from the bottom up over a larger area. As you can imagine, this is slower to heal and it'll be more scar. These scars only regain about 60, maybe 70% of their prior strength at best. If you get back to things too early and the healing process is disrupted by new trauma, your scar may become bigger and or weaker than it should have been. Big scars can limit motion of joints or obscure your vision if by your eyes. Weak scars can open up easier and that results in bleeding, and bleeding can change the course of a fight if it is severe or gets in your eyes. Alright, so those are the general steps of healing that everyone goes through, whether the cut was from a surgeon's scalpel or a John Jones elbow. Now, there are some things that you have control over to optimize your healing. Some of this has been said, but first, if you have a cut, apply direct pressure to help the body stop the bleeding. Direct pressure is really effective and can save lives. The next important step is to keep it clean. Your body's first barrier to infection has been broken down. Do not give bacteria any extra help. Cleaning the wound with gentle soap and water is usually enough, and of course, go see a doctor as soon as possible if the cut is deep. As discussed previously, you have to let your body heal. Do not disrupt the healing by moving the wound too much or getting new injuries, or you can get an infection or worse, scarring. This can be really hard, but it is really important. Next, nutrition is crucial. Healing requires energy, which requires calories. It takes extra protein to build new cells and tissues like collagen. It also takes vitamins like zinc and vitamins A and C to properly heal. This means that you should do your best to have a balanced, healthy diet before injury, if possible, but definitely while healing. Unfortunately, many patients that we must do surgery on, especially the older ones, have poor nutrition that really limits their body's ability to heal. Also, alcoholics are notorious for having poor nutrition. Along these lines, it is important to control other medical issues like diabetes, which is really bad for wound healing. This is through many pathways, including increased blood sugars directly harming tissues. There's poor blood circulation, there's weakened immune systems, and often diabetics lose the ability to feel their bodies, and they end up re-injuring their wounds. Lastly, smoking is an independent risk factor for poor wound healing and increased complications. There are over 400 chemicals in cigarette smoke, also a lot in vapes, you get it. Just one example is nicotine, which disrupts blood flow and inhibits migration of the immune cells into wounds. So just cut it out. While there is not much research on marijuana and wound healing, it would make sense that smoking it could lead to similar poor wound healing issues as tobacco. So, if you are in a state where it's legal, like California where I am, I usually recommend edibles if you are going to consume it. But even then, we do not know the wound healing effects of marijuana. So, there you are. Wounds. Hopefully you've come out of this understanding the complicated steps that our amazing bodies go through to regenerate and things you can do to heal better. Stay tuned for a future video where I talk about the immediate management of cuts during a fight. I'm Dr. Lucius Pomerantz, board-certified orthopedic surgeon and a person who's had his own cuts, trying to educate and help people better understand their bodies. Please like, share, subscribe, and get notifications. Thank you.